We are now going to do trach suctioning. I have knocked on the door, introduced myself, washed my hands, and provided for privacy. I'm going to identify my patient. Can you tell me your name and your date of birth? Okay, and I'm verifying that I have orders to do suctioning. I also want to take note of how often I should be suctioning. That'll be patient dependent. We'll go ahead and don my PPE. This can be a messy procedure, so you want to wear a gown and gloves. You should also wear a face shield or a mask with eye protection. For the purposes of the video, I'm going to leave that off so you can hear me. After that, I will set up my wall. So I have my suction here. It's already connected to my suction canister. I'm going to get new suction tubing and connect it to where it says patient. And then leave this right here so it's available for me. Okay. And I'll also hook up my ambu bag to oxygen. You're going to turn that all the way up to 15 and your bag should inflate. I'm going to rest this right here so I have easy access to it when I'm ready for it. I have moved my table to the head of my patient's bed. This allows me to be able to see him and my sterile field, maintaining its sterility by keeping it in my line of sight. I have also turned on my suction to continuous between 80 and 120 milligrams of mercury. I have assessed my patient's vital signs, listened to his lung sounds, and if I have one available, I will connect him to a continuous pulse ox. Next, I will remove the mask, and you can leave this on their chest, and attach the ambu bag that is connected to 100% oxygen. Go ahead and tell him that you are going to give him a breath at the same time as his inhalation. So when he's ready to take an inhale, you just very gently squeeze the bag, only about halfway. You don't need to hyperinflate the lungs. We'll give him another minute, and then on the next inhalation, we will give another breath. Pop that off and keep it right here handy. We will take off our clean gloves and wash our hands if we have hand sanitizer available. Then go ahead and open your sterile kit. Opening it away from you, making sure you're not touching the inside. Take out the sterile gloves. All kits are different, and some kits may have a pop-up cup for your saline. This one does not, so I'm going to use the container for my saline. While I have it over here, I will go ahead and look at my normal saline, make sure that my expiration date is still good. If it's been opened, it's only been 24 hours. And I will take off this cap, lip it into a trash can if it's been open, and put that right here for me. I'll now don my sterile gloves. I'll take my catheter and loop it around my sterile dominant hand, keeping this port between my thumb and my fourth finger. Loop it around so I have control of the tip right here, and I'm able to connect my catheter here. I still have two hands that are sterile at this point, but I'm going to go ahead and put my saline in here, and I have now lost sterility of this hand. So this is my only sterile hand. I can connect this to suction, and then I will give a third breath. I'm holding on to this so that it stays sterile, making sure not to touch the patient's blankets or their gown. Attach that, and on your patient's inhalation, give a little breath. To remove, it helps to put your finger on the faceplate and pull that right off. Okay. Now I will untwist this, put it in my saline, and put my finger over this port. That is what creates the suction. This is lubricating my catheter as well as making sure that my suction is working. Once we are ready, we're going to tell our patient to take some just calm, deep breaths, and we are going to insert very carefully, not touching the outside. Push it in until you feel resistance or your patient starts gagging a little bit. Pull it back about 1 centimeter, and then intermittently start suctioning while pulling it out, twisting and moving your fingers down so that it doesn't flip up, so you have good control of this. Once it's out, go ahead and suck up some more saline to clear out the line. Give your patient about a minute to recover. You can wrap this back around your hand to keep it sterile. If your patient needs oxygen, you can give them some blow-by here. Watch that pulse ox as you're doing it, and give them about a minute to recover before you do another pass. We'll do one more, making sure my finger is not on this suction when I'm putting it in. We'll go down until we hit resistance, pull back a little, and then intermittently hold on, providing that suction. It should take 15 seconds or less to do this full pass. Once you are finished and your patient's lungs sound better, they don't sound gurgly anymore, you can get rid of this in the trash, clean up your patient's bedside, put your mask back on, and document your procedure. Remember all of your safety stuff, put the bed down, side rails up.